Plato had a quote, and he said, "There's truth in beauty," and I think that's so true. I think what is beautiful, it's different for everybody, but you know it when you see it. It affects you at a deeper level when you see it. It gives you a sense of harmony and balance and peace.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Scott Miller, a fellowship-trained, board-certified aesthetic plastic surgeon known for delivering refined, natural-looking results through an individualized, patient-first approach to cosmetic surgery. Based in La Jolla, California, he's built one of Southern California's most trusted aesthetic surgery practices by combining surgical precision, artistic judgment, and deep respect for preserving each patient's individuality. Dr. Miller has earned recognition from leading regional and national associations for his expertise in facial aesthetic surgery. He has been named Best Cosmetic Surgeon in San Diego by San Diego Reader, received the Best of La Jolla Award in the Plastic Surgeon category, and has been included in Castle Connolly's top doctors list for more than 20 years. In both 2024 and 2025, Newsweek recognized Dr. Miller among America's best plastic surgeons for excellence in facelift procedures. He's an attending surgeon at Scripps Memorial Hospital in La Jolla, a clinical instructor for a UC San Diego plastic surgery residence, and a participant in the Interface International Surgery Program, which provides reconstructive surgical care for children in developing countries. So Dr. Miller, welcome and glad to have you here.
Thank you. I appreciate that. I was like, I'm tired just listening to that.
And I had to cut out even more of your introduction because there was so much in there. So,
well, it's been a long career, so I've done, hopefully put the time to good use.
Yeah. So let's start from the very beginning, though, Dr. Miller. What first got you interested in the medical field?
Yeah, I was exposed to medicine as a kid. My dad was a radiologist, so I was always around the medical field, around the radiology reading room and such. But that's a very different medical environment. I kind of fell in love with surgery. I got the opportunity to put my head in some surgery, probably watched too much MASH on TV, if anybody remembers that TV show, and kind of loved the action. I was really into oil painting as a kid, drawing, sketching, painting, and then obviously, like a lot of people, got really into sports, kind of threw myself full into that and played college sports. And medicine, surgery, and plastic surgery, it all those things meld into there. We have the art and the creativity in plastic surgery that I got from the painting. We have the event mentality and the competition that I got from athletics. We have the contribution that you get from the field of medicine in general, trying to help people, and put those all together, and you get a fairly satisfying many years.
Okay. Now, you have your own practice, Miller Cosmetic Surgery. What was the journey that led you to decide to start your own practice?
So, unlike maybe some others in our field, it wasn't a big ego thing, and I didn't have to be the name at the top of the bill. I just wanted to help people and use my creativity and I think reasonable judgment to try to help people. But I also wanted to do it in a very precise way. I'm pretty micromanaging, which I think is a bad feature for peace of mind and a good feature in a surgeon. So to me, when I practiced sharing office space and looked at different potential partnerships and stuff, they never were going to give me the freedom. I was briefly in academics with academic medical center. That certainly didn't give me the freedom. Working out of other offices and office sharing involved a lot of compromise. And I had a particular way that I wanted to care for patients the way I'd want to be cared for. And having your own practice is a stressful, costly, time-consuming way to get your own way and to be able to practice at the level and style that you really think is the way you'd want to treat a family member or friend.
Okay. Now, you have this practice. I want to dive into some of the specific treatments that you do. So facelift is probably one of the most well-known out there. You're also known for facelift. But what are some of the nuances that go into facelift? Is that something that everyone who wants to look younger, is that the default option for them, or what goes into it?
Not at all. It's basically, I always suggest, and I kind of go into this in my book, Authentic Beauty, to kind of step back and say, what bothers me? Because I think so many people these days are like, when should I be thinking of this? When should I do this? My friends are doing this. Should I do this? And I say, well, what bothers you? You always got to step back. What bothers you? Then you got to go to what's the cause of that. And then you got to go to, okay, what would correct that cause and address that concern. So concern, cause, correction, you should be able to draw a straight line through those and to those. And so when you say what should people do for facial rejuvenation, the question is what's bothering them. Now, sometimes people have really good objective aesthetic judgment on themselves, and others of us may not have that insight. So it's great to get a professional opinion, but an opinion is only as good as the place you get it from. So it has to be someone who you agree with their general aesthetic and approach. And if you do, then you can get a lot of benefit out of a personalized consultation to figure out what is it that bothers you. If it's pores and wrinkles, then look at lasers. If it's dynamic lines from your face, then Botox may fill a role. If it's troughs and hollows, then fillers may fill a role. But if it's lagging and sagging and loss of the deep tissue support, that's where facelifts and surgical facial rejuvenation can really be quite powerful. And oftentimes, obviously, for the more mature patient, all of those can come into play to really get the patient the best result.
Okay. Now, people also often call getting a facelift going under the knife, or I guess that's kind of a broad term for it. So
Sure.
when people say like, "Oh, I'm going under the knife," that like there's kind of a certain connotation that goes along with it. But how safe is it? Because people kind of think about anything surgical going to the knife, like, oh, maybe it's a little bit dangerous, maybe there's like a high level of risk. But I mean, what's the risk profile when they do something like a facelift?
Yeah, well, the first part of your question is kind of a funny thing
Mm.
because I remember early in my career, I was uh, coming down the elevator. I used to share space in an adjacent building here, and I was on the fifth floor. So I'm coming down the elevator, and there was a doctor on the third floor who had just had a big seminar. So some gals got on the third floor, and on the way between the third floor and the first floor, I got to over listen in their conversation. And one of the people was like, I don't know about that facelift, but maybe I'll do the laser thing,
Mm.
thinking it was a lesser thing. And I could tell you people who do a full face laser resurfacing and people who do a properly done modern facelift, they'd say the facelift was a lot easier to go through than the laser. So, there's a lot of misconceptions that lead to bad judgments and bad choices. So, to address that part of your question, I think that first people have to, again, come back to what is it they're trying to address in the first place. What makes facial surgery these days more refined and when it's appropriate is when and so the going under the knife part is, well, modern anesthesia is incredibly safe. People operate on newborns, people operate on geriatric people for a variety of reasons. So modern anesthesia and modern surgery and modern monitoring with ERAS, early recovery after surgery applications, as we discussed in the book, are all so highly developed now that we can take great care of patients and ensure their safety, and oftentimes more than in cases where people are twisting themselves into pretzels to avoid anesthesia. So many times things you read in the press where there's bad outcomes or medical problems are situations where they were working so hard to avoid having a proper board certified anesthesiologist there and having the proper sedation for the procedure with the proper monitoring and whatnot, that they gave the patient a little Valium, a little more Valium, a little more Valium. And pretty soon it was anesthesia without meaning to be anesthesia and
Mm.
without the protective devices, monitors, and personnel there. So that to me is what a lot of times you get into trouble. I mean, Michael Jackson got in trouble because he had anesthetics given to him in his bedroom at home, essentially, to get a good night's sleep. Joan Rivers got in trouble because of procedure creep, where she was in a clinical office and they kept giving her more and more sedatives in a procedure that should have been taken to an operating room and given her proper sedation to get her procedure done, which was not cosmetic in any way that I'm aware of, but basically, nevertheless, it was procedure creep. So modern surgery and modern anesthetics and monitoring, when properly applied by an office with integrity and certification, ensuring that integrity, is very, very safe. And then it comes down to the surgical refinements to really get people the result. And that comes down to like the nuances, as they say, the devil's in the details, and really, really attending to the little things And that's why you want to go to somebody who's done it over and over and over and over and over, such that they're in the refinement phase, not the learning phase of the practice.
Got it. Now, I want to dive deeper into that thread you brought up as far as one of the common misconceptions. I want to dive into other common misconceptions or myths that you hear all the time when it comes specifically to facelift. What are some of those other common misconceptions and other myths that you often hear from your patients?
Yeah, well, when it comes to face rejuvenation in particular, it's that it has to be underdone or overcorrected, and that it's a matter that there's three versions: tight, tighter, and tightest. I remember seeing a patient, she's like, well, I don't like that doctor because he doesn't pull too tight, or that doctor pulls too tight. And it shouldn't be a question of either. It's technique related, it's deep plane, deep layer related. It's what you're doing in the deeper structure to move the tissues as a unit. If you think about it, no one ever snuck in the middle of the night and separated your skin, your fat, and your muscle. They've been connected since you were born, and they should stay connected till the end. What we do, rather, for modern contemporary rejuvenation, or what I call facelift 3.0, facelift 1.0, release the skin, pull the skin. Facelift 2.0, release the skin, maybe give the muscle a little tuck, and then pull the skin. Both of those cause tightness at the area of the incision, which leads to thicker scars. They cause some distortion. They really don't give you lasting improvement in a lot of ways in the forward part of the face, because it's all based on the skin tightness in the back, lateral, upper, outer part of the face. So those all have limiting factors, in addition to creating a huge plane of space for fluid to collect, and dividing a lot of those natural connections that give your face its character. So facelift 3.0, where we move the tissue as a unit in the same way it fell, is much more sophisticated. It's composite facial rejuvenation. So you hear a lot about the deep plane these days, or the deep layer, because there's not really a space there necessarily. So I like to refer to that approach as a deep layer approach, and that deep layer support. And I agree with that, but it's deep layer support. In order to be support, it has to still be connected to the other tissues. So it's a composite movement, a movement of different type of tissues moving together. Kind of like if you wanted to move the living room couch, you pull on the living room rug, as opposed to just yanking on the couch, scratching the floor, and rumpling up the rug. So if that helps a little bit, just that's kind of a more sophisticated way of doing it. So people who think it has to be overdone or undercorrected, no, it could be done properly, sophisticatedly, in the right vectors, in the right way, and then it just looks natural. It's not a matter of Goldilocks, too much, too little.
Got it. Okay. Any other common myths or misconceptions you hear all the time?
I think people think they know what a facelift looks like because they see the bad ones.
Mhm.
They don't know all the, then the other people just walk right by them,
Mhm.
go unnoticed, or just appreciated for their beauty and handsomeness. You cannot tell a good facelift.
Mm.
I do not think that it's obvious in any way, and that's the whole idea. We're supposed to be kind of a funny analogy, but we want to be cat burglars, not vandals. We have to get in and out, and people can't tell we were there. The only sign we were there is just the enhanced beauty we leave behind.
Got it. Now, when it comes to recovery, what's a typical recovery look like? Because I know that's one thing on the non-surgical side when it comes to aesthetic procedures is, if it's non-surgical, then the recovery is much faster. Sometimes it's the lunchtime, whatever they call it. They can just come in for lunch and then get it done, and then they go back to work afterwards. And then they say facelift takes a lot longer. But what is the true recovery time people need to consider if they want to do a facelift?
Again, when people talk about a facelift, they could be talking about so many things. The term gets used very generically. So people say, I had a full facelift. What does that mean? Does that mean your face? Does that mean your brow, your eyes? Did you have a lip lift? Did you have a neck lift? Did you have all of the above? Is that a full facelift? So we obviously, in surgery, and we break it down. There's brow lifts, eyelid lifts, there's lip lifts, there's neck lifts, there's lower face lifts, there's all this stuff. And we just try to be as specific as we can with our words so we know what we're talking about. But generally speaking, people are going to look pretty good within a week, and able to be around people who don't care if they know, but they look pretty good. And then within 2 weeks, they can be out and about and back to their normal things, maybe with their hair down if the incisions are still a little pink, even though they're inside the ear, or some other caveats. Obviously, sometimes healing takes a little bit longer, and depending on the procedure plan and on what the patient's had done before. If a patient's had previous surgery and it's more of a fix-it operation, then there may be swelling and scarring that lasts a little longer. Swelling is still there at 2 weeks, even 6 weeks, even 3 to 6 months, but it's subclinical swelling. It's swelling that you're swollen, but you still feel a little numb. You still have little areas that are still settling, but they look great to everybody else. They're just areas that we know scientifically still have a little bit of swelling in them. So, but clinically, when you can be out and about and back to your normal routine, it's usually 2 weeks, except for the extreme physical stuff. What I like to say is the 3 Bs: bearing down, bending, and bouncing. Those 3 things you're going to have to wait 6 weeks for, because just like if you broke your arm, you put it in a cast, you wouldn't shake it every 5 minutes. It's the same thing with your face. When we disrupt those tissues, we need to allow them to heal.
Got it. Okay. Now, I want to move on to another procedure, is the structural fat grafting. I think
Yes.
a lot of people have heard about facelift, but I think very few people have heard about structural fat grafting. So let's start with, what is it?
Well, so fat grafting was a procedure that was innovated quite some time ago in South America, and then kind of lost favor because of lumps or bumps or fat that didn't last. And then it was brought back by a gentleman who recently passed away, Sidney Coleman, but he kind of innovated and more of a micro fat grafting. And they've used the term nano grafting and whatnot, which I think overemphasizes or over exaggerates its precision. But small fat grafting put into, as he said, parcels, kind of like planting a field. You need healthy tissue around it to supply it. It's a graft. You're taking tissue from one place, you're refining it, purifying it, filtering it out, and then putting it in another, and asking it to survive, and asking that tissue around it to nourish it, okay, until it develops its own blood supply. So that's the nature of a fat graft, as opposed to a fat flap or shift, which maintains its blood supply and is just rotated into a different area. So fat grafting, as described and developed by Dr. Coleman, is a very useful adjunct in many areas of medicine and plastic surgery. However, with regard to facial rejuvenation, it's my opinion it gets so overused and over relied on, oftentimes to sort of hide, camouflage, or bolster up a weaker facelift technique. I think a proper facelift technique can usually do the job on 90+% of people. Occasionally, it's helpful for subtle asymmetries, for people who are really deficient in tissue, who need to be built up and don't want to rely on off-the-shelf kind of fillers. But by and large, shouldn't be your first choice, because the reality with fat grafting, the scientific evidence, is that when you do a fat graft, when you take fat, you put it from one place to another, done right, micrografting into the parcels, etc., basically you're going to have half to 2/3 live, which means a half to a third doesn't. And each time is like rolling a dice. It's a random event. This is medicine, not predictability. This isn't a math equation. So what happens is you might get a 75% take on one side and 25% take on the other side. That might be okay if you're trying to improve atrophy after steroid injection, or improve a radiated breast defect. But that's not great if you're having a cosmetic facial rejuvenation and you were looking for as much symmetry as you could achieve. So I don't like to rely on it as my primary go-to. It is a nice refinement to have and use on the off case where it's necessary, but I think it's over applied sometimes to camouflage weaker, non-deep layer composite facelift techniques. The reason it's referred to as structural fat grafting is that's exactly what it is. It provides structure when it's done well. It's not just squirting tissue in there in a big blob. In fact, if you squirt in a big blob of tissue, you're going to lose all the part in the middle because there's nothing to nourish it. It's not touching anything. It's placed in a parcel, structural, linear technique that can build up the tissue underneath it. And that's kind of how we use it when it's used properly and well.
Okay. So as my understanding of it is, when you're doing a facelift, you would use structural fat grafting to, I guess, give them more support or more lift so they don't look hollowed out.
Correct. But first and foremost, you would try to use your primary facelift technique to achieve that. End. Because if you can do that, you're going to get a dramatically better and, more importantly, equally importantly, long-lasting effect.
Okay, because I think when I hear that terminology, fat grafting, my first thing is that, well, I think about liposuction because people want to get the fat out. They don't want to put the fat in. But I get it makes sense if you're trying to plump up or support the facelift.
Correct. So again, it's definitely a useful way to transfer tissue from point A to point B. What's great about plastic surgery, plastic surgeons, and I'm still in love with the field, couldn't have picked a better field for me, my personality, my my God-given skills and then work acquired skills. So I love the field. I'm the biggest proponent around. I love plastic surgery because plastic surgeons can operate from the head to the toe. Plastic surgeries can operate from the skin to the bone. Plastic surgery can operate on women and men, and plastic surgery can operate on infants and the elderly. I love the diversity of it and the creativity of it. Plastic surgeons are at our base and at our heart problem solvers. That's what we do. So fat grafting is an amazing tool to have in our quiver, an arrow in our quiver, let's say, to attack that. Sometimes, like you said, sometimes with liposuction, you want to take away fat. Sometimes you want to add fat. Sometimes it's the fullness around the dent. Sometimes it's the dent, right? So you want to be able to attack things and problems as appropriate. But you also want to consider upsides, downsides, and longevity of these things that we do, as well as donor site morbidity. When we do fat grafting, we take that fat from somewhere. So we want to make sure, in our population, which is growing ever leaner, not everyone has fat to give, offer, or transfer.
Interesting. Okay. Now,
so that's something we have to consider these days.
Yeah. Okay. Now, I want to bring up personalized skincare. I think when people think about plastic surgeons, maybe personalized skincare is not necessarily a topic they think about. It's like, oh, I'll go to my med spa, I'll go to my dermatologist or whatever for that. And I'm sure a lot of it crosses over with things like facelift. But can you talk a little more about what is the importance of personalized skincare? What can a good plastic surgeon provide when it comes to that?
Yeah, I think you mentioned a variety of places people can get advice on their skincare, and I think all those can be great places. So none of those things are wrong or inappropriate, but I think plastic surgeons have, maybe a particular insight. Dermatologists are very familiar with the skin anatomy, the skin function, in theory and in philosophy and in teaching and training, and that's great. Plastic surgeons have seen the skin from the inside out, all the layers. We've used them. We use the dermis, which is the second structural collagen supportive layer of the skin. We use that for different functions and grafts and support. We put stitches in the skin all the time. We know the strength of the different layers. So that gives us a little insight into that as well. I think that both those fields can offer a lot when it comes to a patient's knowledge and application of good skincare. I think that, I also think keeping it, keep it simple, stupid, right? I don't know about you, but I don't want 10 things on my vanity. And I don't think that's a male female thing. I don't think most people want that. We all have busy lives, and we 10-step process turns into a no-step process. Yeah. So I think it's super important to keep it simple. And, when I explain skincare to people, as I do, again, in Authentic Beauty, I kind of go over, okay, you want to cleanse, correct, hydrate, protect. Those are the steps of skincare. Every skincare product you see, whether it's at Neiman's, Nordstrom's, your doctor's office, or your med spa, every skincare product falls into one of those categories, okay? And so if you keep that in mind and you understand which category that product is falling into, you can better see where it fits or doesn't fit, where it would help or not offer anything in your own personal situation. Because at the end of the day, it comes down to the individual, the person. So, you cleanse. I mean, if you're not gonna clean your face, if you're not gonna use a washcloth or maybe even exfoliant a couple times a week, an exfoliant in the shower, and get rid of the dead skin, I mean, then what does it matter what's going on underneath if you're walking around like a lizard with a layer of dead skin over your skin? Your skin just, using a good cleanser to keep your pores open and clear, and then once or twice a week using an exfoliant or a micro scrub to kind of keep the glowing, alive skin evident and facing towards the world, then that's going to do wonders right there. So cleansing is the first step. Correction is where most people spend their time Googling and spending time and quite honestly spend their money. And that's really valuable, but we'll come back to that because that's, again, that's still a moot point if you're not hydrating, right, and protecting. So you have to hydrate your skin. That could be, you don't want to put like, you don't want to be caulking over like cake frosting over your skin. You want to use hydrators that are shown to permeate through the epidermis, into the dermis, hydrate the skin, bulk it up, puff it up, makes your skin look thicker, healthier, helps diminish fine lines. So hydrating your skin and then protecting your skin. I mean, if you're going to go out and play tennis 5 hours a day and not use sunscreen, or I guess it's pickleball these days, nobody's playing tennis anymore. But if you're going to do that, then like, don't go spending money on retin-A and growth factors and antioxidants and vitamin C and vitamin E. Why do that if you're just going to go out and fry it all the time? Trust me, it's like food, you know. You can't exercise off as many calories as you can eat in an hour, and it's the same thing. You also can't exfoliate an antioxidant away as much damage as you can accumulate if you're not using some sun protection. I'm not saying you should be. I'm not a big fan of people being photophobic and walking around with hoods and masks all the time. I think you just have to find a way to incorporate it into a nice, dynamic, fun, active life, whatever that looks like for you. So coming back, as I said, to the correction factor, which is kind of the more exciting part because that's the tip of the spear and where a lot of the research is done. I think they're all good, and I believe in switching it up. Just like you mix up your cardio and your high intensity interval training and your strength training and your endurance training, I think you should mix up from season to season your skincare. You know, in the winter when it's dark and you're not getting as much sun, and then maybe that's a great time to use retinols for a month or two where you use them at night because they can make you sun sensitive, but they can really stimulate growth of the dermis, and thick dermis equals smoother looking, tighter skin. Maybe in the other months, that's where you kind of lean on definage, which works at the DNA level, or some of the things that amplify your cell's ability to replenish it with growth factors, or just simple antioxidants like vitamin C and vitamin E that can help get rid of the oxidants and inflammatory cascade features that we're always putting off on our skin. Then there's things like clarifiers that get rid of redness and things like that. So there's all kinds of correction agents that are very useful in the skin. The reason I say cleanse, correct, hydrate, protect is because that's the order you want to use them. That's the order you want to apply them when you're sitting there in front of the mirror at the vanity in the morning or the night. So wash your face, put on your correction factor so it gets in there, give it a couple minutes, then put on your hydrator or your moisturizer. And if you're going to be in the sun, maybe throw on a little sunscreen. Or a lot of people have a little light sunscreen in their foundation, a lot of women, and then that does the job for them if they're not, if they're not going boating and they're just going to be getting incidental light. So I know that's a mouthful, but hopefully that gives people a little broad approach, because what I want to do is empower people. That's what my book was meant to do, is to empower people to be able to, when they're told that, I don't want to pick a brand, but this expensive brand from Neiman Marcus is this great brand, they should be able to say, why? What's the active ingredient? What's in it? Where does it fit in? So that, you can spend, a nickel poorly and a dollar well. And I want people, I'm not against people spending their money in the area of beauty, be it skincare, lasers, or surgery, but they should spend it well on the things that count and the things that make a difference.
Very well said. Now, Dr. Miller, where do you think the future of plastic surgery is going?
The great thing about plastic surgery is it could go anywhere. The future will go where the demands require it, because plastic surgery is a creative specialty. The first plastic surgery basically puts itself out of business all the time, because plastic surgery develops procedures in response to problems, and then regional specialties tend to take them over. The first kidney transplant was done by Joseph McCarthy, who was a craniofacial plastic surgeon at Harvard. He did it. He did all the research and then did the first kidney transplant because he was exploring transplantation because of issues he had had as a craniofacial plastic surgeon, trying to reconfigure kids with birth defects and lacking skull and soft tissue and whatnot. So we follow the need. Where aesthetic plastic surgery, the great thing is, I think there's a big movement towards refinement in results and experience. And people are more and more realizing they can have and looking for a natural result. But that's not to say an underdone result, a natural, substantial improvement that makes them truly look like a more vibrant, energetic version of themselves. That's exciting for me because that's my aesthetic. Now, maybe that's not somebody else's aesthetic. And if you want to look fake and overdone and permanently dramatic, then there's probably a doctor for you. But so I think that finding the right fit with your doctor is so important. And I think that's the other thing is trust over trends. Don't follow a trend. Follow your own aesthetic. Find somebody who agrees with that. Look at results. Talk to patients, and then more and more information is available, and then find the right fit for you. And that's what I always recommend to patients. So to me, the exciting things, the natural looking refinement trend, whether it's breasts or faces, it's happening in all fields. More people are going for, breasts that can be in a bar and be in a boardroom and not just, stereotype you into one role or another. And also with faces that look natural and look beautiful, look exquisite, look unique, look personal, but yet don't gather looks because they're particularly unnatural or stereotypical or examples of everything we don't want to see in plastic surgery. So, and then trust over trends. I think more and more people are realizing that they shouldn't get a procedure because somebody mentioned it on Instagram or Facebook. They should get a procedure because there's something that bothers them, and that procedure addresses that. And at the end of the day, it helps them stand taller, smile brighter, and face the world with more confidence, which is what we're really here to do.
Very eloquently put. Okay. Well, Dr. Miller, I do have one last question for you, but before I ask it, I do want to point people to your website at millercosmeticsurgery.com.
I appreciate it.
Yep. Last question for you. What does beauty mean to you?
It's Plato had a quote, not to get too erudite, but Plato had a quote, and he said, "There's truth in beauty," and I think that's so true. I think what is beautiful, it's different for everybody, but you know it when you see it. It affects you at a deeper level when you see it. It gives you a sense of harmony and balance and peace, and kind of a warm feeling, and that's what beauty is peace, and it's balance. It's a river that's still and not turbulent. And I think it's when everything's in harmony and balance and fits together and is reflective of everything else around it. So to me, people are beautiful when their outside matches their inside and vice versa, when it's an honest, truthful reflection of who they are. And those are the people we see are happiest with plastic surgery. If you're an unhappy person and you have plastic surgery, you're going to be a better looking, unhappy person. So I suggest people, know what their priorities are in life, pursue those priorities. And to the degree that plastic surgery can help their looks bring them into better continuity and alignment with that, then that's where it fills a nice important role. And I think that when we feel better about ourselves, when we wake up, look in the mirror, we feel better about ourselves, we stand a little taller, as I said, smile a little brighter, we're probably nicer to the postman and the bank clerk and everybody else we interact with. And that hopefully is a virtuous cycle that goes forward and forward, and maybe everybody can be just a little nicer to each other. So that, to me, long answer, there's truth in beauty, and when you can find that, then that's when you've really accomplished something and helped somebody.
Okay, well, there you have it. Dr. Miller sharing his expertise. So, Doctor, where can people contact you and your practice?
Yeah, again, at our office at millercosmeticsurgery.com is the website. At Katie or info at Miller Cosmetic Surgery is the best way to reach us. I think we have a lot of resources on the website that help people. It also points them towards, or you can go on Amazon, and the book is Authentic Beauty: Defining a New Standard for Care and Results in Plastic Surgery. And I kind of poured my heart and soul and 30 years of my take. I know it answers questions for patients that they have, because I get asked those questions day in and day out. So that's what the book was geared towards, is giving people tools and checklists and different approaches to help them navigate their curiosity and the journey of plastic surgery. It also recommends a practice model to look for, or if you are a young plastic surgeon and going into the field, to create to best serve patients. And then it's got a lot of specifics on specific procedures. So we sort of have the Miller Manifesto, followed by the Patient Manifesto, followed by a lot of tools and tips and techniques and recommendations that people can do in specific anatomic areas. And so I think it really does offer. I've been the feedback we've gotten from a lot of people, even people who had medical issues that were different than aesthetic necessarily, is that a lot of the charts and tools and checklists and whatnot, decision aids, were very helpful in navigating their medical journey. So if I can contribute in that way, that's a fantastic feeling. And if people need more advice, again, millercosmeticsurgery.com or Authentic the Beauty on Amazon are both great places to get that information.
Awesome. Well, Dr. Miller, this is great. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your expertise.
It's my pleasure. Thanks for having me. Great questions, great conversation.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.